Hi, I'm Julie Pippert, and I'm here on behalf of BlogHer and also Momocrats. I'm with Governor Jeanne Shaheen, who is from New Hampshire, and she's currently in a race for the Senate. Hi, thanks for taking the time to talk with us today.
Oh, it's my pleasure.
I just have a couple of questions for you. We're really interested in your race. We love to see women running, and right now, I know that your opponent has got deeper coffers of money. What strategies are you employing to counteract your lesser money?
Well, I think all the money in the world can't correct a record of voting 90% of the time with George Bush, voting against the interests of New Hampshire families, voting down the line with George Bush on his economic policies, on the war in Iraq, voted for every Bush budget. So our goal is to make sure that the people of New Hampshire know that that's the John Sununu record.
And how are you getting that message across? Are you doing a lot of block walking, knocking on doors?
We're doing knocking on doors, we're making phone calls, I'm traveling all over the state, we're trying to get our ads out, we're doing everything we can to make sure that people know the difference in this race and what's at stake, how we're going to turn this country around, and we can't do that with somebody who's voted 90% of the time with George Bush.
Absolutely. I know one of the ways you're looking to turn things around is through improved access to health care. I know you're in favor of universal health care. One of the things that has come up recently is the Health and Human Services is rewriting some of their rules. And what they're doing is redefining birth control pills as abortifacient so that people don't have to prescribe those. Healthcare providers can opt out of it. What would you as a senator do to help protect women's legal choice and access to the health care they want and need?
I think a woman's right to choose is a fundamental right of privacy that women should have. I'm distressed, as I know so many women are, by the appointees to the Supreme Court that George Bush has made. I'm very concerned that we have a president and a Senate who's going to make sure that we appoint judges who are going to protect that fundamental right to privacy. We also need to make sure that along with that comes real access to reproductive services, and that means we need to ask pharmacists to prescribe medications so that women have access. It means that we should make available the morning after pill to hospitals, and unfortunately on all of these issues John Sununu has been on the wrong side. He's not only against Roe v. Wade, but he doesn't support comprehensive sex education for teenagers. He would prohibit that. He would prohibit access to the morning after pill. He argued that government should interfere in the Terry Schiavo case against the wishes of her family. He opposes embryonic stem cell research. John Sununu has an extremist position on these issues of reproductive freedom that are so important to women and families.
And a lot of those rights and access to the health care you're talking about, that's about prevention and keeping women healthy and keeping the family solid and healthy. I know that New Hampshire, like a lot of the states, the United States, has a lot of rural areas. I know rural areas are challenged with access to health care. I'm just curious, what kinds of plans have you thought through with your universal health care system, reaching out to the rural areas?
Well, New Hampshire has a great system of community health centers. We need to make sure that we continue to support those. I believe we need to expand children's health insurance, something that I'm very proud to have been able to bring to New Hampshire. I worked very hard on that. Even when the legislature refused to support it, we were able to get it done. We need to expand that to cover the millions of children who don't have access to care. We need to look at how we move our healthcare system from a system that's based on illness and acute care to a system that encourages preventive care and better management of chronic diseases. That's where 2/3 of our healthcare dollar goes. So we need to move to electronic medical records, and we need to deal with medication errors, which are right now causing the system about $1 billion a year. So we have a lot to do. We need to expand access for people, and we also need to address lowering costs.
Absolutely. Well, the only one last question, and that is just that how can New Hampshire afford to expand this? What kind of assistance would the federal government provide and localities?
You know, about half of our uninsured in this country are people who are employees or owners of small businesses. One of the things that I proposed is a tax credit of up to 50% of the cost for small businesses of covering their employees. I think that's very important for us to encourage business to be able to do that. I think we've got to look at how we can allow people to buy into the federal employees' health system in cases where there are individuals who need coverage. So we've got a lot of work to do, and we need leaders in Washington who are going to make this a priority. John Sununu, unfortunately, has not done that. And in 2006, he was speaking to a group of small businesses in New Hampshire. And when they asked him about health care, his response was, "Stop complaining about health care." He basically said to them, "This issue is too difficult for us to solve." Well, we need to send people to Washington to solve the challenging issues that are facing this country. The American people are up for it, and we need our leaders who are willing to be up for it too.
I agree. You can't succeed or improve or build your business if you don't have your health. So.
Absolutely. It's important to the security of families.
Absolutely. Thank you so much for your time, and we wish you all the luck with your race.
Thank you. It's great to be with you, and I hope women across this country will look at the race in New Hampshire and understand and appreciate what's at stake, because we have a clear choice, and if we are going to change the direction of this country, New Hampshire is one of those places where we need a new senator.